this, we'll be discussing about the definition, what is traumatic brain injury, what are the causes and pathophysiology of it. We'll be talking about the severity, diagnosis, complications, and management that are being associated with TBI or traumatic brain injury. So traumatic brain injury is basically defined as an insult, and that insult is there to the brain. This insult is not because of the degenerative and congenital nature of the brain, but it is because of the external physical forces. And because of this, it results in either impairment of the cognitive abilities of the patient or impair their physical functioning. It can also lead to disturbance of the behavioral or emotional functioning of the person. So when we talk about the causes, specifically when we talk about RTA, and if you look at the data in terms of Indian scenarios, every 5 to 10 minutes, there is a road traffic accident in India. So this is the general data which has been presented by the Ministry of Road Transport and Highways. So every 5 to 10 minutes, because of that RTAs, because of that delay in, getting a proper medical attention, it leads to, of course, brain injury, and thus, survival chances, increasing the mortality, morbidity are more common. So an outside force that impacts the head, causing the brain to either shiver or to move. It can be either because of the physical forces, maybe a direct blow to the head because of any stick, rod, or any kind of thing, or a rapid acceleration and deceleration of the head. For example, if the patient is sitting in a vehicle, if, for example, there is a sudden brake applied to the vehicle, so you see that if the vehicle is moving at a speed of maybe 100, maybe 120, and a sudden rapid application of the brakes causes the person to fall forwards, and because of that, there is high chances of patient getting a knock with the dashboard or with the wind glass which is being there, leading to brain injury, fatal brain injury. So TBI is the leading cause of death, contributing to over 60% of trauma-related deaths. Look at the number, greater than 50%. So what exactly should be your goal or line of approach in management of the TBI? Because of that traumatic brain injury, there is development of inflammation, edema, rise of the intracranial pressure, and CPP, that is the cerebral perfusion pressure, is being disturbed. So your ultimate goal should be stabilization of these parameters, thereby decreasing the incidence of the secondary injury.